Death rates from breast cancer have been dropping steadily over the past decade, while 5-year survival is now up to 90%.
But hidden in these hopeful statistics is a disturbing trend. African-American women are dying at a much greater rate. Dr. Max Gomez here to show us one hospital in the Bronx doing something to help erase that difference. Good morning, Doc.
Good morning, Maurice. Good morning, Mary. You know, that survival gap is all the more disturbing when you realize that white women actually have more breast cancer than black women. Yet when black women get diagnosed with breast cancer, it's at a later stage and they die at a much greater rate. So St. Barnabas Hospital in the Tremont section of the Bronx is taking health care right to the people who need it most.
It might be a death sentence for me.
That's what Patricia Moore says might have happened had she not gotten her breast cancer diagnosed and treated at an early stage. The early diagnosis started as it often does, with a mammogram. What's unusual about Patricia's case is where it was done. Patricia didn't get her mammogram in a doctor's office or hospital. She walked into this mobile van parked on a Bronx street.
It's really an in and out thing. They make you feel very comfortable.
And that's the key. Breast surgeon Dr. Bert Peterson heads the St. Barnabas Outreach Program. He says offering health care like mammograms in places like hospitals isn't enough.
Sometimes intimidating to actually get their health care in these large settings where sometimes there are language barriers and cultural barriers in these large institutions. So it really becomes important to actually engage in what I call taking health care to the people.
So the St. Barnabas van parks outside churches, beauty parlors, community centers. Guillermina Paredes is a typical patient. She couldn't afford health insurance but made just enough to keep her from qualifying for Medicaid. First, she was helped with paperwork. Then she was led back to the mammography unit. Her cancer surgery was just 3 weeks ago. She told me it would have been catastrophic for her had she not been able to walk in and get a mammogram for the lump she found in her breast. And the whole program is working.
We've started to pick up our cancers much earlier, which has not only led to the ultimate outcome of better survival, but we have more women who no longer need mastectomies.
When you can just walk and feel comfortable and have a test done, saves more lives every day, every minute, every hour, every year.
Now, the community approach doesn't end with just getting mammograms. Women are referred to oncologists, surgeons, and social workers that shepherd them through the healthcare system, because getting a diagnosis doesn't do much good if you don't also get good treatment.
So you consider lack of access, is it the most important reason that this is happening?
Well, there's a number of factors at work here. Black women, and I say black women because it's not really African American, Latino black women also have the same issues. They tend to, they're diagnosed at a later stage, but there's also, they come in with breast cancer at an earlier age, and it's a more aggressive form. So there's probably some sort of genetic issue going on here as well. But all of that can, even when you compensate for all of that and correct those numbers and statistics for all of that, you still end up with this disparity in survival, and that we can attribute to access to health care. Right. Or lack of access to health care.
Saving lives.
Yep.
Doctor, thanks so much.
You bet.
All right, turn our attention now.